And now we have a very important topic that Felice is going to be going over, is exactly what do we tell those families at risk, and how can we as endoscopists reduce the risk? Felice, thank you for presenting this.
You know, it's very interesting when a diagnosis like severe, like pancreas cancer, is given to a patient. It brings up a lot of emotions, and many of them are centered around the patient and the patient's care and what surgery has to happen. But after the initial sort of diagnosis is dealt with a little emotionally, what happens is people start to surface and realize, well, what about my children? What about my sister? What about my mother, my father? And those, you know, feelings are very real because they're watching a family member go through a very serious thing. So I hope, you know, in a very brief amount of time to sort of give you a sense of really what are we talking about. So the real question is, you know, what is the real risk? So there's, in general, a low risk of actually getting pancreas cancer, which is part of the problem behind potentially why some people feel we don't have a cure for pancreas cancer. Now, whether that's true or not, but the truth is there is only a 1.3% chance of developing pancreas cancer during your lifetime. And you know, that's among the cancers, a less common type of cancer, but there are certain risk factors that can make you more likely to develop disease. And although some of these risk factors you absolutely cannot change, you can influence some of them. So it's a good idea to lower the risk in any way we possibly can. So the first question that people ask, you know, afterwards is, if I had a family member who had pancreas cancer, am I at risk? You know, that's sort of the baseline question. So about 8% of people with pancreatic cancer have that disease strike another family member. Now, it really is broken down into how close is the family member who had pancreas cancer, how close is that person to you? So if people have two first-degree relatives, and we talk about these things sort of generally, but what first-degree relative means is a parent, a sibling, or a child. If you have two first-degree relatives with the disease, you then have an 18-fold higher risk of getting pancreas cancer. Now, the number drastically changes if you have three relatives. So if you have three relatives with disease, it now changes to a 57-fold much higher risk. So as a physician, when we have someone present to us, let's say that's a family member, like a sibling, who says, my brother had pancreas cancer, we then start to go through the pedigree and say, let's break this down. How many family members really were affected to give us a real sense of what that individual person's risk is. Now, so we were talking about other things that you really can't change. So one is you can't change the fact if your mother, father, sister, brother had pancreas cancer. Another is your race, but this is just discussing that, you know, pancreas cancer just is actually more common in people that are African Americans. We don't really know why. It's said that maybe it's due to socioeconomic factors, and that might have to do with an increased incidence of cigarette smoking among African Americans. It might not, but just when we talk about it, who's at risk? Now, ethnicity also plays a role. When you look at pancreas cancer, there are proportionally more people of Jewish ancestry that have pancreas cancer than the rest of the population, and it's felt that this might actually be due to a specific gene mutation, which is known as BRCA2, which runs more commonly in some Jewish families. Now, other things that you may or may not be able to do a thing about is diabetes. So type 2 diabetes, and you know, we touched a little bit about diabetes. Dr. Lieberman had spoken a little bit about diabetes, but type 2 diabetes is a huge problem in the United States, and that's because obesity rates are increasing in the United States. And this disease is associated with obesity and with a sedentary lifestyle. Now, having type 2 diabetes can actually double your rate of getting pancreas cancer. That's different than type 1 diabetes. So if it's type 1 diabetes, that's not an increased risk of pancreas cancer. But even if you're at high risk of developing type 2 diabetes, let's say your other family members have had it or you are overweight, you can actually change that risk factor by merely losing about 5 to 10% of your body weight and getting 30 minutes a day of physical activity. So that's a huge thing. This is one risk factor we can maybe do something about. And there are recent studies that look at that about 1% of patients who have presented with diabetes, type 2 diabetes after the age of 50, will be diagnosed with pancreas cancer within 3 years of that diagnosis. And that's another thing that lots of times physicians may think about as well when they see someone over 50 that newly is diagnosed with diabetes. It's just in the back of your mind about things, but this just gives you a sense of how important trying to control your sugar levels are. Now, smoking, I cannot say one good thing about smoking. There's not anything good to say about smoking. There's not one disease that it helps on, none. Maybe it helps bring in more tax money, but aside from that, it does nothing good. Smoking doubles one's risk of getting pancreas cancer, and about 25%, a quarter of the people that have pancreas cancer have smoked. Now, I just wanted to give you this example because we always think it's they're smoking up to the time they get pancreas cancer. This is not true. And the reason why I put this here is to talk to your children. For example, smoking during just college, you know, hanging at the bar, having fun with the drink, 2 to 3 time fold increase of pancreas cancer in people who just smoke at that point in time. So if you want to slash your risk of this disease, stopping to smoke would be a great place to begin. Now, I know Alyssa's going to talk a little bit more about diet and exercise, but a diet high in meat, especially if it's grilled, barbecued, or broiled, has been linked to a higher risk of pancreas cancer, and that's, at least in men, that's been seen. But certainly we do see, in comparison to that, lots of fruits and vegetables may actually lower your risk, and just bringing back that diabetes, obesity, and physical activity have absolutely been linked to an increased risk of pancreas cancer. Now, there's another thing that Dr. Cahalan may speak about, and this has to do with pancreatitis, and that's a condition where the pancreas becomes inflamed. And having pancreatitis can also sharply increase your risk of pancreas cancer. Now, there are 2 types of pancreatitis. One is something called acute, and the other is called chronic. And acute pancreatitis usually goes away after like a couple of days, and that usually happens with relationship to gallstones or alcohol. Now, acute pancreatitis can become long-term pancreatitis or chronic pancreatitis, and the very common reason why that happens is related to alcohol use. So there are absolute studies that show heavy alcohol use and binge drinking, especially in men, lead to an increased risk for pancreas cancer. So here's another plug on something that's not good to do if we want to slash our risk of pancreas cancer. Specifically, the way that I would think about this is if I had family members that had pancreas cancer, I would seriously look at myself if I was drinking or smoking, that these are significant risk factors that I do not want part of my lifestyle. Now, so this is a classic question that people come to me, you know, which has to do with am I at risk. My mother and her sister both died of pancreas cancer. Am I at risk? Are my children at risk? So that really comes to ask the question, who gets pancreas cancer, right? So there's a group of people that are called sporadic, and then there's a group called familial. And sporadic means, and that's most people. These are people who have no genetic tendencies, no obvious genetic predisposition, and they just get pancreas cancer. That's called sporadic. Then there's this other group called familial, and what that means is that about 10 to 15% of people, you can see actually some kind of defined genetic problem in that group of patients. For the most part, we don't exactly know what the problem might be, but there are some that we do. So some people actually have what we call a single gene mutation, which means in their DNA, there's actually a gene that is mutated that contributes, that can lead to them getting pancreas cancer. So there's more than this, than what I'm showing you actually on the screen, but the 3 most common ones, one is called a BRCA2 mutation. This, you might have heard as BRCA1, it's really linked with breast cancer. BRCA2 is linked with both breast cancer and ovarian cancer. Then there's another gene mutation, it's called a mismatch repair gene. It's associated with something called Lynch Syndrome. And then there's another gene called the trypsinogen gene, and that's associated with hereditary pancreatitis. And I'm just gonna very briefly go through these 3 different things. So BRCA2 gene mutation. Now 10% of people who have pancreas cancer have a BRCA2 gene mutation. And there's one specific mutation. It's called 6174 with a deletion of T. That's found in about 1% of individuals who are of Ashkenazi Jewish descent. You know how at the beginning of the talk I spoke about maybe that's the reason why? And that might explain the Ashkenazi or the European ancestry increased risk over, let's say, Catholics or Protestants. Now, testing is currently available for this mutation. Lynch syndrome is something that we much more often talk about when we talk about colon cancer. It was also known as something called HNPCC, or hereditary non-polyposis colorectal cancer. And basically, these people are at very high risk of getting colon cancer, endometrial cancer, stomach cancer, and ovarian cancer, but they may also have an increased risk of pancreas cancer. And in this group of patients as well, we also can do genetic testing to see if someone has Lynch syndrome and then potentially follow them for their increased risk of pancreas cancer. Hereditary pancreatitis is also another very rare disease. It's characterized by a very early age onset of getting very severe attacks of pancreatitis. And there's a gene that we can actually test for in these families that's called the trypsinogen gene. So what preventative examinations can be conducted and how frequently should we do them? So at the current time, let me tell you what there's a consensus on. There's basically no consensus, unfortunately. So but the main questions are, there's no consensus on who to screen, how to screen, including what's the best imaging, how frequently do the screening, or what to do with the findings, as they're often very subtle or unclear significance. So let me just tell you at Weill Cornell, what do we do? If we find someone that we think is at increased risk because they're presenting with, let's say, 3 family members or 2 family members, especially if a family member is young, let's say below the age of 50 or 60, or if they have a family history of any of these gene defects, what we typically will do, we'll put them into a screening program that will be followed very aggressively. And that usually involves initially a very high quality MRI scan. And if anything at all is identified on that scan, they may get an endoscopic ultrasound with a biopsy of the pancreas. That's really at this point in time the best that we do, and certainly we try our best to take a very careful history and watch these patients carefully. But just as a last thing, like I said, smoking, alcohol, probably the best thing we can do if you have a family history of pancreas cancer. Thank you.